Okay. Hi.
Okay.
Sorry.
Hi.
Hi, I'm Kenna. I'm about to be a senior at the University of Texas in Austin, and I just got back from doing the SIT India Public Health Policy Advocacy and Community Program. I'm a health promotions major, and I have a specialization in community health and wellness.
Great. And so I just have a couple questions for you about the program. A lot of prospective students have questions, and so I think this would help with anyone who's possibly interested in this program.
Awesome.
So what was the main reason that you chose this specific SIT program?
Well, I knew a lot of my friends were going to Europe, and I knew I didn't exactly want to do that. I wanted to do something that was a lot more different of a culture and like a very different experience than what everyone else had done. And so I thought maybe India would be a cool country to go explore, like something really different. And so I went on my school study abroad website, and I ended up coming across the SIT program and a couple others. But the SIT one just really stood out because they had excursions and they had the internship ISP portion of it. And it just looked like a really unique experience. And I was really impressed by everything I saw on the website. And so I decided to go with SIT.
Great. And then are there any specific skills that you feel you gained while on the program?
I definitely gained some independence and confidence with just, I guess, traveling internationally. The teachers gave us a lot of support and guidance, but they also did give us a lot of independence to travel alone and to do our own experiences and to just kind of explore as we needed with or without their support. So they definitely provided us support, but at the same time, we got to be really independent. I also think I gained a lot of patience while I was there because things would change, like lectures would change, our excursions could change, and it definitely was just really valuable to be really open-minded and just be ready to kind of go with whatever happens. And so I think that was a really valuable skill, was learning how to just say, okay, like something's going to change and it's all going to work out. So I think that was really valuable.
Great. And then, you kind of touched on this a little bit. Do you think there's kind of one thing in particular that you learned specifically in India that you couldn't have learned back in the States?
Yeah, I think I learned some I just gained some experience with doing cross-cultural work. So I did the internship portion, and I got to do a lot of hands-on work with people in the field. And so I got to work with translators. I got to do interviews using translators. And I think that's something I would not have been able to do in the US. And so it was really cool to be able to experience doing all of this work in public health that I want to do, but doing it in a very different setting and having to consider the cultural context while I was doing that work. And I think I wouldn't have gotten that anywhere else.
Yeah, and do you want to kind of expand on what you did during your internship?
Yeah, so I went to Maharashtra and I worked with an NGO called the Community Rural Health Project. And I was able to work on, they have a grant from the World Diabetes Organization, and I was able to work with the Adolescent Boys and Girls Program and do a little education on diabetes for them. And then I also got to work in their preschool, which serves the slum that is nearby the CRHP campus. And I did kind of a study on malnutrition there and got to work on like a menu to help kind of combat malnutrition in the preschool.
Oh, very cool.
It was really great.
Yeah. And let's see. So what was you probably have a lot, but if you could hone in on, a couple or two favorite things of the program.
One of them was just the people. We had a group of 16 girls and 5 staff members, and we got really, really close. I'm still in contact with a bunch of them. I visited my teachers right before I left India a week ago, and I'm planning on visiting some of the people on my program over some of my breaks in school. And so I think because of the structure of the program, we got really close as a program, like as a group of people. And I think that was one of my favorite parts, was being able to have this really unique structure that let us get so close with our teachers and get really close with our fellow study abroad students, because that definitely helped the program. Like having people there to support you and to help you and go through all the craziness together was really, really unique and was really awesome.
Great. And how was your homestay?
My homestay was great. I ended up rooming we met the first day we got into India. He's one of my really good friends now. We roomed together, and we had 2 host brothers and a mom and a dad and a grandma, and they were awesome. I'm still in contact with one of my brothers, and so it was really fun. I had a really great time.
Great, yeah, just because I know some students tend to be like a little nervous about the homestay experience, but like I say, a lot of them come out really, really enjoying that part. So I'm glad that you're still going to be able to contact with them as well.
Yeah, and you get put with another student, so it definitely eases any nerves or any tension is having another student there as a support system in your homestay too.
Sure. And so if someone had never heard of SIT before, how would you kind of describe it to them in a few sentences?
I would say it's a really unique study abroad program that really encompasses culture and the area that you're in, and then also whatever field you are there for. So ours was public health, and so the program does a really good job of tying in the culture and public health. So we had speakers and professors and lecturers from the area come in and talk to us about public health, but in the context of India. So it's really unique in that they take you in the field and show you actual real life experiences of whatever field you are studying. So it's, I guess, a mix of the language, the culture, and then the field that you're studying. And it just, I know that.
No, that's great. I think that's a good summary, because it's cool that you're, in a classroom, but you also get to do a lot of stuff in the field. And then for you, for example, you did the internship, so putting what you've learned kind of into practice.
Yeah, you get to do a lot of real life hands-on experience with what you learn.
And so I know you kind of talked about how you kind of are just back and you stayed on with the organization that you did your internship with, but are you planning on, continuing the work that you've done in India for like a senior thesis or something back on campus?
So I knew I wanted to do something in public health coming into the India Study Abroad program, but coming through the program, coming back, I realized that I want to do nursing and public health. So going abroad helped me figure out what within the public health sphere I want to do. So I'm going to nursing school after I graduate undergrad, and so we'll see where I go from there, but definitely staying in the public health sphere.
Well, that's exciting. Yeah. Well, is there anything else that you'd like to add that we didn't cover, or any other thoughts?
It was just a really great experience. Like, I would recommend it to anyone that's looking to study abroad and get a really different, really unique, really valuable hands-on experience. I'd 100% recommend it. So.
Great. Well, thank you again, and thank you for being an alumni mentor.
Yeah, no problem.